Okay, so here we are in another session of patient provider series. This is how we call it, right, Tasha?
Yeah.
Uh, Patient and Provider Series. I am Dr. Velázquez. FND Hope is being represented by Tesha. We have done introductions in the past 3 videos, so we were thinking about suggesting you to go back and read and watch those videos. I'm Dr. Velázquez. What else should I say? Tesha, what do you want to say about your introduction?
Yeah, I do work for FND Hope. I didn't know I haven't talked to them about this, but this I was kind of doing separately. But yeah, I've been diagnosed with FND since I was 17. I'm on the research committee of FND Hope. I run their young adult support team, and then also studying pharmacy and yeah,
Hmm?
trying to live life.
You're now in Seattle. It's almost
Yes.
Christmas time of 2024.
Yes,
Hopefully
I'm
this
back home, which is
video,
nice.
hopefully this video will make history. So everyone, remember where we are and where we can get, right?
Yeah.
I am, I represent science and shamanism, educational programs for healing and preventing FND at a social educational level. I'm now in Brazil doing psychedelic research for functional neurological disorders and spiritual realization and well-being. Let's get started. Today we are talking about social life. And now it's Christmas, so it's a lot of social activities, a free time, vacation, social life of a young adult, because Tisha, she's in her 20s, right?
Yes, barely. I'm 21.
21. And you said, I have had some experience with F&D since the age of 17, so for 4 years.
Mhm.
Um, I'm 41, so I'm going to give a little bit of my personal and professional experience. But yeah, this is social life of a young adult and a middle adult physician with F&D. Where should we get started? Where?
Um, I guess where I would start is there's an element I think that I understand about the experiences that I've had where I've experienced kind of negative interactions because of my FND. In the context of, I think sometimes it kind of comes from fear of, if they've know I have seizures or they've witnessed a seizure, a fear of being with me or around me. It's not a personal thing about me, but of course it has that impact. Um, I think what's unique about being a young adult, especially with seizures, um, is you're in this weird nebulous phase of life very often. Of course, every situation is different, where if you were in high school or kind of earlier in adulthood or teenagehood, um, there would be kind of a designated caregiver by default of parents or guardians, kind of. And I experienced that when I was diagnosed at 17, that, even if I had a seizure at school or if I was with friends, there was a designated person to call, kind of to help manage it. And my parents very kindly took that on. Obviously, not everyone has that, but that tends to be my experience with people in high school who are diagnosed with FNDs. Their parents kind of do the advocating and management if there is a seizure. And then people later in life who I've met with FND, sometimes spouses or other immediate family can take that on. But if you do choose to live independently or go to university or things like that, um, and there are moments where you are incapacitated in a way that you can't advocate for yourself or communicate what is needed. Um, it's kind of like who manages that. Um, is it your roommates, if it's in your dorm, and it becomes very nebulous, and it's not something that I would ever want to put on a random 20-year-old who just happens to be assigned to be my roommate, right? Or a classmate or even a friend. And it's a very nebulous situation to know how to navigate. That, of course, everyone with FND experiences stigma, but it makes it more difficult, I guess, socially to know how to live independently if you have moments where there would usually require someone to advocate for you in that way and kind of manage. If that makes sense.
Yes, this is interesting. Let's see. So the what others feel, and actually everyone, because I feel that doctors also feel this, the fear of the unknown.
Hmm.
There is a person with a symptom with some kind of discomfort, right? That is functional. And then because we have no education about it, doctors don't know what they are dealing with, parents, friends, and family. Can you hear me well?
Yes, yes.
Okay. So people don't know what it is because there is no education. There is this fear of the unknown, which is an
Hmm.
existential fear that we all have. So this is so important because patients with FND all often feel ashamed or guilty or they want to hide because they observe the reaction in others. So
Hmm.
it is so important what you're saying is like, wait, they are fearful because of the unknown.
I
It's
think, yeah,
uh-huh.
that can be part of it. And I think there is a lot of stigma with functional conditions in that way. But also even, even epileptic seizures would cause fear in someone. And I think some of the fear might stem from not knowing the seizure is functional and thinking it is epileptic and that there is an element of of life threatening. You know what I mean? That can also be the reaction from peers of, seeing a seizure is scary to witness. And even if you are told like it's non-life threatening, that doesn't mean that's not your immediate visceral reaction of assuming it is, even if you have that knowledge. But yes, I do agree. There is an element of unknown and stigma that comes with functional conditions as well.
So you're saying, okay, whoever is around us, patients or people who
Hmm.
sometimes get functional symptoms, make sure that you are comfortable with this fear of the unknown, fear of witnessing something potentially serious happening to someone you care about. If it's a doctor, you're in the doctor's office or in the emergency room. If it's a friend, you're hanging out with them. So, hey, network, be aware of this emotional response of the fear of the unknown, fear of being in front of something serious and not knowing what to do. Emotional there. Now you brought about another point, which is a stigma, and that is a cognitive aspect. We're not going to get into that. I don't think um we have been for about 10 minutes. Okay. So let's put a pause on the stigma, right? Emotions and cognitions, fears and a stigma. The network needs to be aware of this
Hmm.
for the social life of everyone to be good.
Hmm.
Then high school comes around, so we're changing the scenarios and focusing more on high school, for example. And then I really like this concept, the designated person.
Hmm.
I like how you use that. I like the description. And then you mentioned parents sometimes take on this role,
Hmm.
spouses, sometimes a roommate, a
Hmm.
classmate, a friend. So what is this designated person to call, designated person to help? Uh, and I want to already give my perspective, which is I think everyone should be capable of dealing with the commonest condition affecting the human nervous system. I think everyone should be a designated person to call. Everyone should be well informed. But give me your opinion on this support.
I absolutely agree in theory, but unfortunately, right, it's not often the case, which it definitely complicates things. It's difficult. I don't know if it's a universal answer. So for me, like I know my plan with the university is I have a pull cord in my room that I can pull, and then, security will come and they're first aid, but they're fundamentally not medical professionals, right? And then if my roommates or flatmates observe it, then they can call security. Um, bless you.
Thank
Um,
Sorry.
um, but if it doesn't happen while I'm in my dorm, it's a very complex question, and it's something that if it happens outside with friends, that they're left to manage, kind of, unless they want to call paramedics, which they know that, if they want to, they absolutely can, because it's not their job to manage it, but that is not necessary or my preference. Um, but it's always a difficult thing to broach with someone who's in their 20s, especially because they might not have a lot of medical exposure to experience. I think as you get older, you get more interactions with people with various conditions, but the younger you are, the less likely you are to have interactions like that. And it's hard for me to know, like, when is the time to mention, like, hey, by the way, I have a seizure disorder, like this, and it's unfair to not mention it, but it also feels unfair to me to have to mention it at the first interaction, because it doesn't feel like the biggest piece of me. And it often raises a lot of questions that, I don't always want to answer and that I don't necessarily feel like is the way I want the conversation to go. And so it's kind of a difficult thing to broach of like, when do I bring this up and how do I make it clear that it's not their responsibility to manage me? But at the same time, I really don't want medical professionals called in this context if this occurs, like emergency medical professionals, because it's not an emergency in that way. And here's the best way to support me. And it looks scary, but it's not actually threatening my life. It's just a difficult way to frame and also make it clear that they don't have to manage it, but also that this isn't who I am, and that like this is, also not make this my biggest identity factors, which if it's early in the friendship, sometimes it feels like, I'm saying like, before you can become friends with me, you need to know this about me. And that feels like I'm saying then it's the most important part about myself, which it's not, but it is an important part of their awareness about being with me, but it feels more like it's then assigned to my identity, even if they don't see it that way.
Hmm. Something that came to my mind as a possibility for, as a summary, I have to put it in the blog post. Everyone, you can find all the blog posts associated with these videos in my website. You have to let me know, Tesha, if we should put it in your social media and stuff too. But yes, so Tesha, an image that came to mind is a ladder, another ladder or a pyramid of social influence and wisdom.
Hmm.
Social FND influence, FND wisdom. So who are the people that first and foremost need to learn? Then who is next? Then, for example, physicians, healthcare professionals, then security, then teachers, then, right?
Hmm.
Like what is the most important population to target? That came to mind. I'll leave it as a reflection. Then you mentioned the other really nice, interesting, important question. How do we make people aware? Because you're right, teaching happens at all levels, personally, in a small setting, group setting, in a large speech audience,
Hmm.
right? So when should I introduce it? I have my own ideas, but let's feel the body for this one. I'm curious about the opinion of the body because I often say, yeah, functional symptoms are nervous system processes, but they show through the body,
Hmm.
right? They are so physical. The body has so much to do with it. So to improve it, to change it, to really understand the causes, to really have agency over what happens in our body and have that really good mind body connection. We have to know the opinion of the body and the emotions. So let's pose that question. Uh, when should I introduce it? When should I mention it? Feel the body, feel the emotions. I'm gonna get my charger. Feel free to talk whenever you feel ready.
It's interesting as you were talking, I was like my feet started to move, like I was like definitely like more energy or like it is like a discomfort almost. And then like my hands felt a little like tingly or like not numb, but like I don't know, more active, I guess. But yeah, definitely a like desire to like stay away from answering that question. I think maybe it's the movement being like, oh, let's move away from this. But I think it I think it's hard. Like it's unique to the person and my I get uncomfortable thinking about it a little bit.
Okay, so this is great, right? Like this is the first step, and we're already doing together a little bit of teaching on how we discover the message of the body, the wisdom of the body. So yeah, just notice that. I just think it's everything in the hands and feet. Some action there, some activity. So see, connect to emotion. See if your mind has any opinions, any interpretations there.
Um, it's interesting because moving away from the question almost feels like trying to move away from that part of like the reality of being friends with me or interacting with me, of me not wanting to define myself that way or be defined by that by others and moving away from that. Maybe it's me moving away from the question because, of course, if I answer the question, then it is addressed at some point, right, in the relationship. And I think, in an ideal world, I would never have to address it. And it's something that I wish I didn't have to do, I guess, in that regard. Um, yeah.
Mm-hmm. Yeah, this is really nice how you are noticing, and this is a common feature that modern
Mhm.
human beings, including myself a little bit at the beginning of my own journey, we're becoming more cognitive. So a lot of the time when emotions appear in an intense manner and physical sensations, the cognitive mind is like, no, 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 no. I like this cool. I like it when I'm not too intense. Like, wait, you're interrupting my thinking emotions. Stay away,
You're getting
right?
in the way. You're getting in the way. Yeah.
Oh, we have become very cognitive. But we can get used to it, no, Tisha? Like
Yeah.
keep exploring the relationship. And of course, something that we know and we always have to recommend to people is whenever it gets too uncomfortable. Who's the boss, right, Tisha? It's like
Yep. Yep.
whenever it gets well too intense, like, hey, hold on, I'm not ready to feel these intense sensations, then you say like, I don't even want to go there, right? Like not
Yeah.
not
Rock the boat, but don't end up in the water.
uh-huh.
Yeah.
So I think this is part of healing, becoming the agents, and also especially around the holidays, and especially when we have to answer uncomfortable questions, is to say like, I don't want to talk about it right now.
Yep. It's the easiest, I think, approach, but mo definitely the most ineffective one. Because you can avoid something, but that doesn't mean it's not there.
Exactly. So you
Yeah.
you're now noticing charging. So you're now noticing the benefit of sharing the story, sharing all
Yeah.
the wisdom. So tell me a little bit about that. What are some of the benefits of sharing?
It's really interesting because my level of vulnerability with FND has historically been incredibly, incredibly limited. Um, Even with really close people in my life. I was reflecting that I've been diagnosed with 4 years, and I was diagnosed initially during COVID. So really only close friends were aware that it was happening because, to classmates and to people who I wasn't like interacting with individually, but we had interactions on a day-to-day, they still saw me logging into Teams. They, they weren't necessarily aware. And I think that was true for a lot of people during COVID. They were going through things that other people weren't aware of. But even with my closest friends, I was pretty vague. They knew I was diagnosed with a seizure disorder. There was kind of an inciting non-FND medical incident that led to the development of FND, and so they were aware of that. And when I was in the ICU, and then the subsequent development of FND, I'm not going to lie, I kind of used the previous experience to say like, oh, it's kind of like an expansion of that. And in a way it was, but not in the way that they probably inferred me saying that. So they knew I had seizures, and they were very kind. They were very loving. They would bring meals to my family. Like, they were very, very supportive, but I was very not vulnerable. I don't even know if they knew the name of the disorder I was diagnosed with. And when I went out of state for treatment, again, very supportive, calling me, asking me how things were going, how treatment was going. I didn't specify what the treatment was, like what I was doing. I was just very like, things are going well. And they could see that I was doing better, right? Like they could see when I was on the phone with them, I was more like myself. I was having less seizures. But I do think they didn't really know. And I think that was definitely by me. Like it wasn't their lack of desire to know, but they were very respectful of me being kind of vague. And when I went to university, so that kind of stayed consistent throughout high school. Eventually they knew the term FND, but I never explained what it was. So I'm sure they Googled it. And I'm sure they got some interesting takes from the internet. But I didn't clarify. I just let them, they never asked, I never clarified. So eventually they did know the name of the disorder. And then when I went to university, that continued, where I would say like FND, but I would never expand on what it was. I would just say like it causes seizures. And for the first time, I explained it to someone like a couple weeks ago. And I remember thinking this is actually kind of a big moment for me. And it's ironic because I do it all the time at work, right? Like I am always talking about what FND is, the factors that contribute it. I do it with the young adult support group. I do it with the research committee, but in my interpersonal life, no one knows what FND is. They just know I have it. So it's very interesting, the dynamic there, or the juxtaposition there. And I remember thinking when, the person had known I had functional seizures, is what I say. I have functional seizures. So no, I always specify that it's not epilepsy, but I do have functional seizures. And finally, he was like, what causes functional seizures? I was like, FND. And then he was like, well, what's FND? And it was the first time someone had asked instead of just saying like, oh, okay. And I thought critically, and part of me was like, oh, it's kind of complicated. But then I was like, you know what? It's like midnight. We're not going to have this conversation right now. Let me think about how I want to have this conversation, but I will tell you because he's one of my best friends. So then I ended up making a like 45 slide PowerPoint presentation. This is how I decided to go about the conversation. And it was like not at all academic. I mean, there was like research referenced, and he's very like scientifically literate, and he's in my program, right? So I did like use science, and it was scientific, but there was also like GIFs and clips and inside jokes, and it starts with a video of a fish flopping.
This is so fun. This is so
The title slide was "Why does Teja flop like a fish?" And then it had a fish flopping to give context as to how I approached it. Like it was simultaneously vulnerable, but also like me recognizing that this was a conversation between friends and it didn't need to be super academic or emotional. You know what I mean? I feel like I balanced the three of like emotion, academic, and then also just like, I want to approach this with my personality. Like I included the clip of kindergarten cop, it's not a tumor, explaining like how it can't be seen on an MRI. So I just like I tried to make it both, like I tried to be vulnerable, but also recognize like it doesn't need to be a big emotional conversation. And I think it went well. I think that was the right approach. Who knows?
Yes.
I don't know if he was expecting a 45 slide presentation to
Ah,
a 3-word question. What can I
Yeah,
say?
yes, I guess I'm gonna ask him, but I we don't have time to listen to that answer. But a question that came to mind is like, were you perceiving his response to the presentation, and did you think he was enjoying it and finding it interesting and informative?
He definitely laughed at the right moments, and was thoughtful at the right moments and
Okay.
engaged in asking questions. I do think there was an element of surprise, I think, that there was a psychological component that I think he wanted to do his own research on and process instead of ask about. And I felt a little bit of hesitation because he was asking questions and I was like, well, I can send you all these studies. And I remember him saying, like, I want to do my own research. And I was like, oh, that's dangerous, right? There's some studies that I'm like, oh, but also that's absolutely a fair response of like, this has sparked an interest, but I want to approach it like the way I would approach anything else and not but I felt a little bit of anxiety and a little bit of like nerves of his desire to continue to research independently because I wasn't sure where that would lead. But I do think that does show an interest of like, I think I explained it enough to explain that it is very complicated and that it really can't be summed up in a 43 slide presentation.
Mm,
And the fact that his takeaway was, oh, I need to do more research, I think, that is a good takeaway from any presentation on FND because no presentation is going to explain it in a way that like someone's going to walk away and be like, I understand everything. I don't need any more information. You know what I mean? So I think that is a good outcome in the end, but it did make me a little nervous, not going to lie.
wow, there is so much there, and we're running out of time. Like we have 1 minute or so. I think I'm gonna leave all these questions for the write-up,
Yeah.
and you can take a couple weeks because we're not gonna record the next one until
Yeah.
so. But some of the questions that we're gonna leave for the write-up and the blog post is what are some of the terms that feel more truthful, maybe maybe positive, that bring people closer, that represents the disease or the disorder in a nicer manner. So
Mhm.
that I wonder what about the treatment, uh, where you're not too comfortable hiding, not too comfortable sharing, or that you felt like it was better to like hide it under the rug and not give details about the treatment. Um, yes. Oh, and then I noticed, I wanted to point out, I noticed, no, actually, you noticed that how there is this compartmentalization between
Yeah.
work life and personal life,
Yeah.
and then how your sense of humor came to protect and to make the conversation a little bit nicer. You made this presentation utilizing humor, which is also one of my soothing and protective mechanisms. I use humor a lot. So,
I was wondering, I was like, I wonder if that's going to be interpreted as me making light of it or as a defense mechanism. I actually think I would have been more comfortable having an emotional conversation. But it was recognizing because it's a very emotional thing for me. It's hard for me to joke about with people in the context of
mm,
explaining it. I joke about it with people who already know about it. But I think for me, it was recognizing that like he's going to be intaking a lot of information. And if I make it very personal and emotional and meaningful, it might be very overwhelming. And that might take over the actual science part of it. Um, and in making kind of, I was vulnerable in parts of it, but it was very intentional. And a lot of it, I think, was just also recognizing this is a conversation between friends and it doesn't need to be a big thing, was important to me.
yes. And there is always no right or wrong. Like,
Yeah,
right, it's whatever feels good
yeah,
and comfortable, whatever gets things done. Like, for example, laughter.
yeah.
For me, like, my husband is telling me that he's terribly unhappy, and then I laugh, like in his face. Okay, that's really like a bad
Okay.
protect,
Yeah, that's
right?
not, yeah, yeah,
But now, like, I'm having this conversation with you and I'm laughing a lot because I know that
yeah.
that's going to make the conversation
It's
nicer, right?
situational. Yeah, it's definitely situational. Yeah,
So it can be like, okay, I'm like protecting myself here from having a bad conversation. If I'm like, oh, like angry at you, right? Like,
yeah,
I'm using my tools here to protect us from a bad conversation, to
yeah,
protect me from a bad experience. And I'm using my laughter, whether it's in other situations, it's like, this is really destroying you. Like, don't do that.
yeah.
Okay? But anyways, and then I saw that also in the write-up, you could consider mentioning like a little bit of a tag, like a phone, like a script, like how to describe it. Like for people who are ready to have
Gosh,
that first time at this like
that is a
Christmas
big ask,
Eve,
man. That is
a little bit of a
okay.
script with 3 or 4, maybe 5 sentences. I don't know,
For
10.
individuals or medical professionals?
I
Because that's
think
going to be different.
I I think maybe to start with the one from your perspective as a patient, like, hey, if you want to talk about FND with your friends,
Okay.
check
Yeah.
out this script as at least as a way of practicing. Okay, how does it feel to say these things? So we're
Okay, I
going,
could try. It is so
okay.
hard to define FND, but I will try.
Okay, we're really running out of time. I'm gonna send a summary of all the possibilities for the write-up in the email. Take your time, do as little as you want or as much as you want. Then we're in touch. This has been another great conversation, and everyone who comes across this video, feel free to share. This is FND Education Information Patient Provider Series. We have to change the name. I
I
don't
know you
want
don't
to.
like the term patient, so I was surprised that you used it. I don't mind
Yeah,
it, but I know you don't.
let's find a new one for next time. I
Okay.
I think you're an educator. I think you're an educator.
Yeah, but it does describe like I do have FND. I don't know.
Yeah.
We'll figure it out.
Yeah. Okay, we'll figure it out. You guys stay tuned, and girls and non-binary, stay tuned and come back for more videos and check the links in the description and contact us if you want us to talk and collaborate. Go, Tesha. What else?
I think that's everything.
Awesome. Have a
Bye.
great day. See you soon.
You
Bye
too.
bye.